Welcome to Pediatric Associates.
Hi, I'm Dr. Samuel Mirrop, and I've been with Pediatric Associates for 25 years now, and those years have just flown by. We've seen a lot of changes here. So Rachel's going to ask me some questions, and I'm going to go over those with you. So yeah, go ahead and start, Rachel.
So a big thing, Dr. Mirrop, that I definitely go over in prenatal is just the history of our practice in general, as to how long we've been here and the changes that you were talking about.
Awesome. Yeah. So the practice has been here for actually since 1977, which not coincidentally is the first year the first Star Wars movie came out. So just saying that I am kind of as you can tell, a Star Wars nut. So anyway, so over the 25 years, we've really changed quite a bit in some ways. We used to have paper charts, very few insurance kind of issues. But then as the years gone by, those sort of things have changed. We're on electronic medical records now, that sort of thing. But the most important thing that hasn't changed is the time we like to spend with our patients, because that is key. That is key for good medical care. So that is what keeps us going. That's what keeps the patients are happier, the providers, the doctors, we're all happier. So I would say that, though with all these changes with insurance, the main constant that we've always tried to strive for our patients and for ourselves is having good quality time with every patient.
So is that the reason why we have a value added? Because I know that question does come up as well.
Yes, yeah. So the value added program started, I believe, like from 14 years ago, and what kind of made us have to do that is as more insurance plans came on board, they kept cutting our reimbursement. So we've actually not had an increase in reimbursements for over 15, 16 years. So we had to make a choice. Do we hire non-RNs to do our shots? Do we rush through patients? Do we schedule patients every 10 minutes? Do we get rid of our lab? Because we have a lab here that is very, very convenient for our patients, and actually I think really helps with patient care, but it's not very affordable to keep running that. So other economic things that kind of forced our hand to do this value added is some of our weekend hours. You do have to pay staff extra to come in on the weekends. So we have Saturday hours, Sunday hours, and still, again, the time we spend with the patients hasn't changed. And so that's kind of been our commitment to keep that quality there. And the only way to help to afford that sort of thing is to do the value added program.
So only registered nurses are here in the office?
Yeah, so the shot, so the big part, I mean, obviously there's lots of things our awesome nurses do here. Giving shots is a big part of that, and you want someone giving the shots who really knows their stuff. And our RNs are so well trained, and they know all the ins and outs of all the different vaccines, and so obviously the physicians know, but the nurses are the one actually giving you the shots. So we think it's so important to have highly qualified nurses to give you your shots. So in summary, our practice has been around for a long time, and we're really proud of the fact that we offer good quality care. We spend time with our patients. We have availability not only during regular hours, but even our after hours clinic as well. And we are really excited to have you guys come to our practice. Wish we could have met you in person, and we will in the future. But right now, with all that's going on in the world, we're just doing this by video. So good luck with everything.
Thanks, Dr. Mirrop.
You bet.